Welcome to episode 64 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're discussing intrinsic control of GFR, or glomerular filtration rate. This is the kidney's built-in ability to regulate its filtration rate without external input. By the end of this episode, you'll understand how the myogenic mechanism and tubuloglomerular feedback maintain stable GFR and the role of the juxtaglomerular apparatus, or JGA, in this process. So let's get started. The kidney's intrinsic control mechanisms allow it to maintain a stable GFR despite fluctuations in systemic blood pressure. This autoregulation ensures that filtration continues at an optimal rate, which prevents excessive fluid loss or toxin buildup. There are two primary mechanisms of intrinsic control: myogenic mechanism and the tubuloglomerular feedback. These mechanisms adjust afferent arterial diameter to regulate blood flow into the glomerulus, which keeps GFR within a normal range. The myogenic mechanism is a reflexive response of smooth muscle in the afferent arteriole to changes in blood pressure. When systemic blood pressure increases, the afferent arteriole stretches out due to this high pressure. This causes smooth muscle to contract, which causes vasoconstriction. This reduces blood flow in the glomerulus, which prevents an excessive increase in GFR. However, when systemic blood pressure decreases, the afferent arteriole relaxes due to lower blood pressure. Smooth muscle dilates, which increases blood flow into the glomerulus, and this helps restore GFR back to normal. This autoregulatory response happens instantly, which provides rapid adjustments to momentary blood pressure fluctuations. The second intrinsic control mechanism is the tubuloglomerular feedback, and it's mediated by the juxtaglomerular apparatus, which is a specialized region of the nephron where the distal tubule passes between the afferent and efferent arterioles. Now, the juxtaglomerular apparatus has two primary components: the macula densa cells, which are in the distal tubule, detect sodium concentration in the filtrate. And then there are the juxtaglomerular cells, which are in the afferent arteriole, which release renin to influence blood pressure. So, if GFR is higher than normal, this means that more filtrate will be flowing through the nephron. Because this flow is occurring more rapidly, sodium reabsorption will be reduced in the ascending limb. Basically, it's harder for sodium to lock on to the pumps to be pumped out. This causes the macula densa cells to detect high sodium levels, and so as a result, adenosine is released, which causes afferent arterial vasoconstriction. And as a result, GFR is reduced, bringing it back down to normal. Conversely, if GFR is lower than normal, that means less filtrate is flowing through the nephron, which makes it much easier for sodium to be reabsorbed. The macula densa cells stop releasing adenosine because of this low sodium, and this causes afferent arterial vasodilation. Ultimately, this will increase GFR back to normal. This process functions as a negative feedback loop and fine-tunes filtration based on sodium concentration in the tubule. So to summarize, intrinsic control of GFR is achieved via the myogenic mechanism and tubuloglomerular feedback. The myogenic mechanism adjusts afferent arterial tone based on systemic blood pressure. Tubuloglomerular feedback regulates GFR through sodium sensing by macula densa cells in the juxtaglomerular apparatus. These mechanisms ensure stable kidney function without reliance on nervous or hormonal control. So that's it for episode 64 of the Pulse of Physiology. I hope this episode has clarified how intrinsic mechanisms maintain GFR stability. So join me next time for episode 65, where we'll explore extrinsic control of GFR, including neural and hormonal influences. Until then, keep questioning, keep exploring, and stay curious.